I'm your host, Meredith Dykstra, and as you can see, Cellular Healing TV is being recorded, not at our usual spot. We've got Dr. Pompa, our resident cellular healing specialist out in Park City, Utah, but I have joined our resident biological dentist, Dr. Derek Grieco, here in his Murraysville office, and that's where we're going to be filming from today. And Dr. Grieco is joining the show today to talk all about safe dentistry. So we're really excited about this topic. Before we jump in, let me tell you a little bit about Dr. Grieco. So Dr. Derek Grieco has been in practice since 1993. He's a 92 graduate of the University of Pittsburgh School of Dental Medicine. Upon graduation, he was very blessed to do a year residency program at Allegheny General Hospital in Pittsburgh, Pennsylvania. Then he entered an existing private practice in Murraysville, Pennsylvania, of which he has been fortunate enough to serve the community for the past 21 years. He specialized in general dentistry for many years, but in the last decade and a half, he's been moving in a more holistic direction. Dr. Grieco believes that good health begins in the mouth, and treating illness begins with an assessment of the mouth. To that end, Dr. Grieco has spent countless hours studying and learning to turn the practice into a more biological, holistic direction. In the late 90s, a good friend who is a chiropractor encouraged Dr. Grieco to begin investigating biological dentistry and safe mercury removal. He turned to the IAOMT and Dr. Hal Huggins Alliance. Since that time, biological dentistry has become Dr. Grieco's life passion. He's received extensive training by Dr. Huggins and Dr. Blanche Group in the Huggins Group Safe Mercury Removal Protocol and related modalities. Dr. Grieco has a real passion for his patients' health and well-being and loves to assist each in achieving their wellness goals through biological dentistry. He's a member of the IABDM and IAOMT and the Huggins Alliance. He's a member of the Weston Price Foundation and the Academy of General Dentistry. He's a member of the DOCS for sleep dentistry. Several days a month, Dr. Grieco travels from his Pittsburgh office to the Centers for Healing East Coast Clinic of Blanche Group in Scranton, Pennsylvania, to perform dental revisions in that office. And I've been married for 20 years, 4 kids, very into health and fitness, and a community member. I mean, you've got so much, Dr. Derek, such a well-rounded man, and we're just so blessed to have you on Cellular Healing TV. I know you and Dr. Pompa have quite a history.
Oh, we do.
So
I'm blessed.
I made the bio. I was the friend that totally investigated. So
That's right. That's where it all started, unfortunately.
it is. You know, it's funny, Derek, and you know, him and I will refer to each other as Derek, and you probably call me Danny because that's what everyone, you know, from my older friends call me. But you know, it's funny because it really did start back then. And normally I'm asking people, so how did you get into this? Well, you know, I know how he got into this because it started with me getting sick, and I'll let Derek add to it, but. You know, it took me several years to figure out what was going wrong. And it was after 2 fillings were removed, and Dr. Grieco, Derek put in a gold filling, and I still had about 6 amalgams in my mouth. And it was really after that, you know, the encouragement of an endocrinologist that said, man, I think you have mercury poisoning. I was like, yeah, I thought so too. You know, and I ended up doing another test, not a blood test, and finding out I did have high mercury. And my question to him was, what do you think I got it? And he said, did you have any dental work done around the time? And Derek, I remember, I said, yeah, gosh, I had this gold put in, you know, and I do remember feeling really bad after that, but I thought it was the anesthetic, if you remember correctly. And I never really associated, even though it was really soon after that, I mean days, literally, that I didn't start feeling well, but it just kept complicating to anxiety, digestive issues, allergic to the planet, insomnia, you name it. But that's where it started. And it wasn't, I remember the day I took a handful of things to Derek, because I love him, man. I know he didn't do it on purpose. You know, Derek and I have known each other since elementary school, right? I mean, am I right on?
Right.
And Derek was a super guy. I mean, you know, everybody loved Derek. I mean, super athlete, super guy, amazing student. I'm going to embarrass him if I keep going. But I took him this stuff, and I was like, hey, man, you got to read this, you know? It's like, and, you know, this is what's happened to me. And I told him my story. And, of course, he was very polite, and he was like, oh, wow, you know, okay, you know, I check it out. But it wasn't until, I don't know how long after that. It was a year or two. I don't know what it was. But Derek called me and said, I want to take you and Marilee to dinner. And great, And he called me and said, he apologized. He said, I just didn't know. But, I started looking into that and reading the stuff you gave me and going beyond that. And he's like, I'm going to change my whole practice. I'm going to change what I do. And he did. So I could get tears in my eyes even thinking of that, because he did. And he took us to dinner and apologized. And, not that you had to apologize. You didn't. It wasn't like that. You were doing what Dennis did, and you were doing exactly what your ADA told you. And I'm sure your stance was thinking it was safe, but you found out. I don't recall what stimulated that, Derek. You could tell that part of the story. Like, what made you all of a sudden say, okay, you know what, I'm going to look into this now?
Yeah, initially and thank you, Dan, for saying that. I mean, you loved me enough, and I tell this story all the time, that you loved me enough to come back, and I get tears about it too, because of thinking that I was helping my patients all these years and I was harming them. And what happened with you was tragic, and fortunately through God and education and some practitioners that came into your pathway to help you, in turn you loved me enough to say, hey, you need to look into this. Well, that what happened to me was, it was probably when I went to my first meeting in Florida after you had given me the information. I was paralyzed for a year. I didn't want to touch anybody, because I knew a little bit, but I didn't know enough. So I had to spend another year, learning and just transforming my practice, which is still happening today too. But had to come in contact with the Huggins Institute, Dr. Hal Huggins. He's passed on since then, but he was the father of biologic dentistry in this country.
He was, yeah.
And his partner, his right-hand person, Dr. Blanche Gruby, who I am internally indebted for what she did for me and how she trained me hands-on in the protocol, and being able to go to her practice the last couple of years, which I'm not doing so much anymore, but in the last few years, I'm just totally blessed and in gratitude to her for what she did for me. And that's sort of how I started getting involved in being more comfortable and pursuing the biologic approach to dentistry.
Yeah, and because you're there, thank you, Meredith, for going there, because I really want today to be about how you do a safe removal. Just because a doctor is in the IAOMT or maybe another organization that does safe dentistry, or sometimes called biological dentistry, it doesn't mean that they're doing it. This has happened to me, as I had clients and I said, oh, go here. And then they told me what they did, and I'm going, oh my gosh. So, I really want the show to be about that. That's why you're there. But I think for, some of our viewers and listeners, it's worth talking a little bit about the pitfalls, the untruth, if you will, or the truth about amalgam fillings, root canals, cavitations, and just spend a little time on each of these. I had interviewed Dr. Jerry Caratola. He's the dentist, for Dr. Oz, and he's been on his show. And on that show, he pointed out that amalgam fillings are in fact dangerous, and mercury in them, etc. And that was a gutsy move, because obviously a lot of criticism. But in that interview with him, I had said 75% of all disease starts in the mouth, and he said it's more like 85%. So. When we look at why, there's many, many reasons why, but it does. So many conditions, so many people that are still sick have had amalgams, and I say had because they'll say, well, I got them out 20 years ago, but I'm still sick. Please listen right now. That mercury is turned to inorganic mercury, vaporized from those fillings, turned to inorganic mercury, and is locked in the brain. And oftentimes what we find is a year later, after the fillings are out, all these different new symptoms start, because the body goes through of letting go of certain things, and it mobilizes the detox pathway already shut down at the cellular level and downstream, and symptoms start. So even though you had them out, this conversation is very relevant for you, because detox needs to occur correctly. That's why my passion, Derek, has come out of this. You know that. I mean, so thank you. I should be thanking you. Matter of fact, I guess I owe you a dinner, because I would never be doing what I do today, changing and saving lives, educating people on this topic, if I didn't get sick, right? I mean, honestly, I was already on my way, to dealing with things, just getting it out, just, sped that up, I'm sure. But so warning number one is, just because you had them out, you have to start detox. I like to start at least a week after they come out. And warning number two is, don't just get these things taken out of your head. There is a preparatory phase that I've trained doctors in. And by the way, don't just do any detox either. That's what I'm doing. I'm training doctors on this process, because most people do this wrong. This has been something I've been passionate about for years, because I had to learn. I had to learn all these things the hard way. But okay, so with that said, Derek, amalgam filling, I mean, we get it, but a lot of our viewers don't. I mean, talk a little bit about the dangers of amalgam and what you learned.
Yeah, well, thanks. And like Danny said, Dr. Pompa said, the preparatory phase is huge. So there's a lot of true cellular detox doctors out there, not to plug your guys, but your men and women that you've trained. They really have to plug in with somebody like that, because my part of it is very small. The prep phase, the removal phase, you find a good dentist that can do it within the correct protocol. And then the detox chelation phase after, being the body and the brain cleansing, is so important. But anyway, finding a dentist, you can call the IAOMT and the IABDM and the mercury-free dentist, and you can find them all over the country. There's some awesome dentists out there. When you come into the office, you just want to ask and look for some certain things, how they were trained, how they would treat, how do they take out a mercury silver filling, what's the correct way to do it.
Well, and I think that they'll get that when we go through the process, and going through it, I think they'll see that these are the major things, right? I mean, but, just talk a little bit about, okay, you thought at one point that amalgam filling was safe because your ADA taught you that. Now, I don't want to get you in trouble with your own board here. So I know that there's, you're not recommending anybody take out amalgam fillings right now. But let's talk about what amalgam filling is and what you learned.
Right. I'm sorry, Dan. I totally went the opposite direction with that. When you look at a mercury filling, it's made of silver, copper, tin, and mercury. So the major ingredient, over 50%, is mercury. So when you look at that, and that's why they call them silver fillings. Well, I have silver fillings. Well, if they called them mercury fillings, I don't know how many people would be willing to put that in their mouth. I really wouldn't know that. They would. I don't want that in my mouth. Being what we're learning about mercury today, even in the environment. If you spill it, I mean, you'll have the hazmat crew and the EPA after you.
Right.
When I was in dental school, matter of fact, in the chemistry building, they closed down a whole block at the University of Pittsburgh because there was a mercury spill.
Yeah.
And so we're putting that in people's mouths. Well, it off gases. You can even go on the IAOMT website, and it shows you under infrared spectrometry, infrared camera, where they have an extracted tooth and they rub it, and you can see the off-gassing of the mercury vapor. And like you said before, that mercury vapor gets changed into inorganic mercury, and it goes into the brain and the nervous system. The hypothalamus and the pituitaries affect our thyroid and our adrenals, and you wonder why people are having trouble.
And by the way, Derek, that's what threw me for a loop for a long time, because I knew my adrenals were trash. I just couldn't adapt to stress. I mean, not even loud noises. It was too stressful. I couldn't even go to movies. I couldn't watch football games. I remember, when you're back there in Pittsburgh, I remember watching a Steeler game. We had some friends over. I couldn't handle the excitement. I can't even call it stress, because I'm not like this diehard Steeler fan where it was like if they lost, I was devastated. But I just couldn't handle the excitement of the game. I literally had to walk away. I was embarrassed. I just made stuff up and moved aside. Loud noises, movies, I couldn't do any of it. My adrenals were shot, and my thyroid was gone. I mean, my hair was thinning. I mean, all these, crazy things were happening with my body temperature, and that was what tipped off the endocrinologist to say you have mercury poisoning. But I would address my adrenals. I would address my thyroid, just like so many people do. I would take all these things. I mean, some things would get better, but ultimately I was worse. I mean, it would, like, if I would address my adrenals, you know, my energy might be better, but I would have massive insomnia and more anxiety. It was like crazy, this up and down game I was trying to figure out. But, you know, Derek, you said it. Studies show, and you've read the same studies I have, that stuff bioaccumulates in the center of the brain, your pituitary hypothalamus, that controls your thyroid and your adrenals. So, I mean, it's, you know, this is what people don't get. It's not my opinion. It's not yours. When we look at all the bans on this stuff, countries banning this, except right here in the United States, you know, I think this is when we should become fearful. So, you know, Derek, just to point this out, because I say it, but I think it matters more from you. When that stuff comes into your office, not that it comes into your office anymore, but it comes in a little jar that has a skull and crossbones on it. Keep out of the hands of children. Mm-hmm. And it's handled as hazardous waste before it goes in your mouth. Am I right so far?
Yes.
Okay.
Now they have it packaged they have it packaged in a little plastic capsule, so you don't actually, the big jar it comes in, you remove it from the jar and it's in these little plastic capsules. So there's not a skull and crossbones on that. It's made to look, oh, this is just a regular filling material. Mm. So for example, when you say that, you know, in California, they actually hand out little certificates to patients that they shouldn't be using them on pregnant women and children.
Right.
So that's already been being done in California, but it's okay to put it in on everybody else.
Yeah. And before it goes in your mouth, it's called hazardous waste. It's great as hazardous waste, according to OSHA and the EPA. The moment it goes in your mouth, it's downgraded. It's considered safe.
Right.
Yeah.
Right.
With very little, you know, with very little, maybe some precaution. The moment it comes out of your mouth, that you extract that. Now, that extracted material, when it hits the dental plate, you have to, that's considered hazardous waste again, and you have to handle it as such. Am I right?
Exactly. We have a special canister that we collect it in. It's an amalgam separator from our mercury separator from our suction unit. We have to canister that up, and it's marked in a red bag, biohazardous waste, and we have a company come and pick it up.
Oh.
So.
Yeah, well, exactly. So, I mean, my comment to that is, I mean, don't insult my intelligence. You know, it's before it goes in my mouth, it's called hazardous waste. The moment it goes in, it's called safe. And the moment it comes out, it's hazardous waste again. Arguably, because your mouth is acid, it's more dangerous when it's in your mouth.
Yeah, and here's the other thing. You know, when we were in dental school, and I'm very appreciative of my dental school education in the University of Pittsburgh. And we were taught that once it's mixed together with the silver, copper, tin, and that mercury is amalgamated together and we pound it into a tooth, it's inert. It doesn't react. And that's what the ADA guideline, that's what they told us. Right. They've since then changed their stance on that a bit because of what's been happening recently in various organizations that have been pushing back and showing their side of the research. But interesting.
Yeah. So, I mean, I think that's what we all need to say. And, you know, look, you know, this stuff is poisonous in your head. However, make sure that you learn the things we're going to talk about today. Real fast before we get into that, let's just touch on root canals and cavitations. These are two other dangers that lurk in the mouth that cause unexplainable symptoms, diseases, etc. So talk a little bit about those two things.
Yeah, good question. The issue with root canals and cavitations is more from a biotoxin standpoint.
Right.
And if you look at a tooth, and a lot of times I'll draw a picture of a tooth, and I'll show them the inside of a tooth, show a patient the inside of the tooth. Your tooth has over 3 miles of little canals inside of it with the main nerve trunk. So think of a river, it would be the main nerve trunk in the tooth, the main nerve, the blood vessel, and the nerve in the tooth, and the little streams that are coming into that tooth. That would be the little canals inside your tooth. There's over 3 miles of that.
Yeah.
In every tooth. So we have some awesome endodontists, people that are doing unbelievable root canals with ozone and lasers. And the problem is, once that's cleansed, the bacteria recolonate in those little tubules. There's no way to clean that tooth out completely 100% and have it stay patent and cleansed forever. It
Right.
Those bacteria give off toxins just like we do. When we eat food, we give off, we urinate and poop, and the bacteria do the same thing, and it affects your immune system, puts a taxation on your immune system.
Yeah, I mean, arguably those biotoxins, those anaerobic bacteria that are in there, they're more toxic than even mercury. I mean, they really are. There's many who feel it is. I can tell you this from my experience is that, I got mine out, and there was no pain, there was no signs of it being a bad infected root canal. However, when I got it out, things changed. This did. My gut, I would say in particular, it was a big deal for my gut. It seemed like I could start eating more foods without reacting. So obviously, there was biotoxins affecting my microbiome somehow, some way. But, it had an impact on me. And some of it could have been galvanism. I mean, there were some metals in there that were reacting to still the fillings that were in as well. But, it really had an impact on me. And I can tell you this, many of my clients and doctors' clients, their life changes when these hidden infections are taken out. And, I had a woman, she had massive headaches. I mean, I'm telling you, like debilitating headaches every day. And she got some of these root canals and cavitations, which you'll speak to in a second, out. And I mean, all the pills she did and all the things she did right, it was the only thing that made a massive difference, where she wasn't getting them every day. I'm talking immediately. I mean, where it was like the intensity went down, then it was not getting them every day. I mean, just from the removal. Of course, then we started the detox, and things rapidly changed from that. But that's the power of that. Now, I know Warren was just in your office last week, right? Last week, and you were checking him for cavitation.
Right.
Because, again, some of his things, I said, Warren, it could be a hidden infection. You need to get checked for cavitation. If you've had wisdom teeth or teeth removed, something could be left behind called a cavitation. Speak to that.
So there's two issues with that. Just like when you had your root canal taken out, number one, that helped you because it removed the biotoxin that was affecting your microbiome and your immune system. Number two, it has to be done correctly. If it's not done correctly, then you can be left with what's called a cavitation, whether it's in an old extraction site like you had in the premolar tooth, or it's in your wisdom teeth areas.
Right.
So what happens is, the reason why it does happen, a lot of times we use epinephrine. We use an anesthetic that has a vasoconstrictor in it, makes the blood vessels constrict. And so there's not a lot of bleeding. Actually, you want the opposite. You want a lot of bleeding after an extraction to help, remove the toxins from inside the bone area, and also be able to form a nice blood clot in there. Secondly, once you remove a tooth, you want to clean out the periodontal ligament. The ligament is fibers that connect this is your root of your tooth into the jawbone by various little fibers called the periodontal ligament, which acts as a shock absorber and also supplies nutrients to the tooth as well. That has to be cleaned out. So you have to take a little instrument. I take a little round instrument up in there rotating, and you actually clean out that socket of the ligament. And those two things are very key in not having cavitations formed after surgery. So wisdom teeth are a lot of times big areas of cavitations. So
right. And these things are nasty. I've seen them ruin people's health for years, and they just have no clue. When I was sick, I had one wisdom tooth out years ago. And so reading this, I said, well, I'm going to get that checked. They looked at an x-ray, and you can tell me if there's more modern ways to do this, but they looked at an x-ray and they saw a slight lucency, a slight little dark area So he just took a drill and just kind of drilled in, almost like you would do in drywall, right? You have that feeling when you don't hit the stud, it kind of goes, and then boom, it falls in.
Right.
He kind of did that, and he said, yeah, there's some hollowness in there, and then he went and cleaned it out. Maybe things have changed a little bit today, but that's the way I had it done. But
that's the procedure. And according to Dr. Groovy, who's trained me extensively in cavitations, now she uses the Cavitat machine, which is a specialized ultrasound. There's not too many available left, or not too many left in the United States.
Right.
Anymore. Now there's another promising technology. It's a 3D cone.
Yeah, the X-ray, yeah.
So you can actually see them on those. So I utilize those a lot. I have a couple practitioners in the area that take them on our patients.
Yeah, I've heard about that. I've heard it's much more effective than a regular X-ray where we're just looking at lucency.
And sometimes you can see them on X-rays. You can see the outline of where the tooth used to be.
Yeah.
So we're most of the time pretty confident that we get in there and we go through that little cortical bone. We drop right down into a little cavitation area, clean it out like we do an extraction site, cleanse it, and I use ozonated water. It's not the Huggins protocol with the ozonated water originally.
And I know some people are doing some laser stuff too that works very well.
So once you're getting that anaerobic bacteria, you're opening up to the oxygenated environment.
Yeah.
You can also look at the site, and you can have it assayed by a company that will do a DNA study on it and tell you exactly what that cavitation is encompassing.
Yeah, I encouraged Warren to get that done. I said, I want to know, right? I want to look and and see what it is, and know what bacteria. Just because that's the way I am. All right, so.
Well, I have a question. If someone does have a cavitation, is it pretty guaranteed that they are going to have some kind of infection, some kind of challenge? Or, I mean, if you've had wisdom teeth removed, is that pretty likely that there would be an issue?
Pretty much.
Well, cavitation is an infection, but.
Yeah.
Okay.
Yes, pretty much. And it's just another piece of the puzzle. So when we look at the total oral environment, mouth environment as a relation to the body, we look at silver mercury fillings. We look at even other metals that are in your mouth, not only silver mercury, or the mercury, but the other metals that are involved in crowns and even gold fillings, and the root canals and the cavitations. So all that ball of wax works together to remove appearances for the rest of your body.
And Meredith, maybe this is part of Meredith's question. Maybe not, but I'll fire it away anyway. What are the chances, if you've had wisdom teeth removed, what are the chances of there being a cavitation?
That's a great question. And even without the study of the Cavitat or the 3D cone beam technology, me personally, and even with talking to Dr. Groovy, it's in the 95 to 97 percentile. There's rarely do I get in there and I go in and I'm like, this is solid, there's nothing here. Doesn't happen very often. But I don't want to give a false sense either that when you do cavitations, sometimes they don't heal 100% and you have to go in the second or third time. So it's, you try to get optimum healing, but sometimes that doesn't happen and you have to go back and cleanse again.
I had a client recently, they got the body scan, the heat, what's it called?
The thermogram?
There you go, yeah. And it showed some hot spots in the jaw. And they showed it to me and I said, did you have any wisdom teeth removed? And she said, oh yeah. I said, you better get that checked out. And sure enough, where the hot spots were, there was cavitation. And again, once it was corrected, I mean, absolute transformation in their health. And in this case, it was autoimmune. Just shows you what would keep the immune system reacting. So hidden infections, look for them in the mouth. And I think that's the message here.
That's another good point, Dan. The thermogram is another nice diagnostic tool to use for infection or hotspots. Yeah.
Okay, so we talked about some pitfalls. I think we got people's curiosity built up, but and I'll back you into this because you're there, and I want you to show what a good removal looks like. But for at least a month, we put people on a preparatory phase to get their cell pathways working and their downstream detox pathways working. So there is a prep phase that our doctors around the country are trained on. And again, for someone who's sick, there's a little bit more to it than someone who's just the average person. We sell on our website the prep phase, Meredith, but it's more for the healthy person. No matter what you're going to get work done needs that prep phase. But of course, challenge people. We have doctors trained in that, to make sure that the detox on the other side, you need a coach, and the prep phase. So let's talk about the day of removal now. We developed a product called Bind. I always tell people take 3 or 4 of those before your appointment, 3 or 4 those after your appointment. Now, after that, I'm done. So now it's in your hands, and I want you to show us some of the things that you do right there and some of the equipment. I know you have the IQ Air system that pulls the vapor out, but let's throw Meredith in that chair and just start drilling. Let's see what happens.
Okay. All right, so first, it's important, okay? Well, first of all, you want to make sure you have a biocompatibility report. Some people get muscle tested, some people...
And by the way, especially those people that are challenged, my gosh, that's a great thing. Anyways.
You want to know what materials we can put in your body that aren't affecting your immune system. So it's not like your tooth is going to itch or your gum's going to be...
And Derek, you give that right there. I mean, that's what one of the good dentists do. They typically recommend that. You tell them, here it is, and go get your blood drawn, or you draw it for them.
And it sends us back a Bible of, so to speak, of that patient's, all their materials that they can use. Okay? So let's say Meredith is coming in. She's going to be draped from head to toe. I wish we would have.
I know, we didn't prep very well for this. Although this conversation's piqued my interest too, because I've had wisdom teeth removed, of course, and now Dr. Grieco, might have to check out my cavitation.
And I've sent Meredith some emails going, what about hidden infection? What about cavitation? What about this?
Something people don't know about this. We don't talk about, this. We talk about amalgam removal a lot, but the root canals, the cavitation, that's just an area that's not really discussed a lot.
Yeah, Meredith's right. It's kind of like the second thing, right? But, and even, it's true. I mean, and with my people, we go after the obvious, and then the less obvious comes after they're not responding. It's like, oh, well, maybe it's this, and they go back to their dentist. We can't take it for granted. Usually when someone goes to a really good dentist, they take it all into consideration, right? And they're looking at all these things. But okay, anyways, what do you got, Derek? What do you got there?
Anyway, so when she comes in, she's going to be draped to head to toe. She's going to have a hair covering, glasses. I'm not showing it here. And then she's going to
put it on her just so I can laugh. Go ahead.
Oh, Dr. Pompa.
All right. You don't have to do it, but you just show it.
Here, I'll show it.
All right.
Okay.
I just know. He did it anyway. That's hilarious. Yeah.
All right.
Okay.
Here you.
Then she's
Why are
going
you doing that? So she doesn't take the mercury vapor home.
Well, right. And then she's going to be draped with a special drape, and then she's going to have an oxygen source.
Yeah.
Okay? Then we have the IQ.
Derek, why the oxygen source, and you'll explain why that is too. Why the air supply to the patient?
Don't want to breathe, even though when we're taking this out, there's gonna be mercury vapor coming in the air. So this IQ Air is critical to be right by her face, but we want her to breathe a separate oxygen source, 100% oxygen.
Right, because the mercury vapor is what people breathe, and it's going right into their brain, right?
Exactly. So we're going to try to remove as much as we, remove as much of the risk of exposure as we can, and that's really key. She's going to have a rubber barrier over her mouth, like so. There's a non-latex rubber dam. So when we start treating her, anything that falls on the dam, it'll be sucked up, and we also have suction going behind the dam too. And on the dam also, I use this product. This is a mercury scavenger. This isn't in the Huggins protocol. It's something that Dr. Groovy sort of added to it, and it's actually made in Pottsville, Pennsylvania, and it's a heavy metal scavenger. So it's a cream we actually rub all over the rubber dam.
Oh, wow.
That's another barrier that we use, okay? We also have a negative ion generator running in the corner of the room to help grab any mercury vapor particles that are in the air.
Yeah. Yep.
Okay. So that's basically what you should be looking for that the dentist does.
Now, of course, you have a mask on, carbon mask too, I'm sure.
Yeah, we're all garbed up. We have the same thing, and I can even show you my special filter.
And by the way, considering dentistry as like it used to be #1 in depression, suicide. Now I think it's #2. I don't know what took it over. But #1 in infertility. I mean, I go down the list of neurodegenerative conditions, neuropsychiatric conditions, neuro conditions, all #1 in dentistry. You better protect yourself if you're dentist watching. But yeah.
Now this is very important. This is key. We have eyewear on. We're all garbed up as well. So it's basically, it's not, like I said to Dan before when we were talking.
Why is Meredith smiling over there? She has this like cheesy sharp. Yeah, she has this little grin on her face. I don't know what's going on back there. Okay, all right.
But it's not hard for dentists to do this. It really isn't.
It's true, right? It's true.
Not rocket science. I'm no special person. The other aspect is with the Huggins protocol, and this is controversial. Some dentists don't do this. We start with the highest negatively charged area first. And if we're not sedating the patient, we don't want to cross the midline of that patient because it affects the body's meridians, crossing the midline. But if we're not taking the highest negative out first, we can be affecting the degenerative and the regenerative pathways of the body. So with taking the highest negative fillings out first, we activate the regenerative pathways of the body so people don't feel as crappy afterwards.
Yeah, I can tell you, I've watched enough people go through this to see enough of them react when it's not done to say it's important. If I were a dentist, I'd be doing that for sure.
And like I said, there's no scientific evidence. It's just how doctors.
I know. Thousands of it. I know. And that's why, I'm not going to say a dentist is doing it wrong if he doesn't do that, because you're right. We don't have a study to prove it, but thousands upon thousands of Huggins, people going through it. And I've seen it too happen enough times that I go, hey, it's worth doing just for that.
Right, because I've had patients before I learned that aspect. I would treat a patient, and the next week they said, Derek, I felt terrible after. And because I would always start in the upper right side. I'd do the right hand side, then I'd do the left hand side. And I'd have patients come back in. I felt great. And I'd have other patients come back in, and I didn't feel really, I felt terrible the next day.
Right.
Anyway.
Yeah, and then what about the removal process? I mean, obviously, water plays a very important role, the speed of the drill, perhaps. I mean, we want to minimize vapor. How do you do that?
Very critical. That's a good point. So when I look at removing, I use an electric handpiece. It runs a lot more steady. Electric handpieces, the torque is more constant, and I use real sharp carbide handpieces. We actually squirt water along with the water that's coming out of the handpiece when we do it. We're actually going around. We try to go around the filling. Then we cut a little cross in it, and we try to pop them out. We don't want to drill. We try not to drill it out 100%. We try to make a little indentation and try to pop them or pry them loose.
Right.
And try to minimize the vapor and exposure that way as well.
Yeah.
Exactly.
That's critical. Take it out in chunk as opposed to just drilling and drilling and drilling, creating more mercury.
And then when we get inside of the tooth, I switch to a low-speed handpiece that runs a lot slower, so we're not burning or heating up the inside of the tooth.
I got it.
And because when we get in there, there's a lot of times a tattoo. There's the mercury or the material, the metals, including mercury, that are in that tooth, actually leach into the tubules. Just like your skin has pores in it, the teeth have pores in it as well. Like
I've had people, and we talk about removing the source, right? And people can get away with detox for many months, actually. I always say if you're using a real binder, you want to remove the sources. But people get down the road 5-6 months, and then they start getting some different symptoms, and they may just have a piece of amalgam left in there or an amalgam tattoo. And we realize that the body will almost stop wanting to let go because it knows that there's a source in there. Now, again, it takes some months to get there, so you could do safe detox for several months before you know, because it does seem like it takes a while. But those amalgam tattoos, they can hold enough mercury to stop the body, right, from getting rid of stuff.
Absolutely. There's that's another good point. We judiciously cut those tattoos out, and sometimes it's even into the cortical bone. You know, once you have that tattoo, it's actually a piece of amalgam that was caught underneath the gums, or it could be from the amalgam, the silver mercury filling next to the gum. The electrons from that actually get embedded or tattooed into the tooth as well. And we actually scalpel those out, and we actually clean the bone underneath if we need to.
Yeah.
So those amalgam tattoos are important as well. We also take X-rays during removal, because sometimes we miss a piece, and just by looking, we think we got everything, and we don't want to have to go back in later and say 6 months we take an X-ray and say, there's still a piece of silver mercury missed in there, and you're already chelation, and so we'll take the time to take X-rays after to make sure we got everything removed.
Right. Yeah.
That's a good point. Thanks for bringing that up.
Yeah, yeah. And okay, so did we miss anything? So with the bind would be beforehand. Let's say you're done, take more bind. Why? Because despite your best efforts, some of that stuff can get down into the gut, and we want to protect that gut. That's for sure.
Yeah, and I forgot one of the most important things. We also give IV vitamin C during it.
I was going there next. So yeah, I was going there next.
That's one of the most important things to supporting your body during this process, because of the negative electron donation from the vitamin C, and it also, and you know more scientifically than I do, with the glutathione, it helps to support the glutathione levels. Correct, Dan? Is that?
Yeah, right. Vitamin C actually helps the recirculation of glutathione, your natural body's own defenses, right? But so you do the vitamin C right there, or do you send out to do it?
I do vitamin C right here, and that's thanks to Dr. Gruby again.
Yeah.
We can 25 grams. Sometimes we'll do it. We'll give 50 grams depending on the health of the patient and whether they can handle it or not. Or we may bring them back a day later and do a second dose.
Yeah, and that's typically right after, correct? Right after? Right
during. No, when they first come in.
Right when they come in.
We hook them up with the IV.
Oh, that's great. Yeah. I always had it after because I couldn't get it done there. I had to go somewhere. Yeah. So, and by the way, likewise, if you don't have, I'm speaking to people, the dentist doesn't have that in their office, you can go somewhere that does. Or what we say is, hey, is a second best option, a vitamin C flush, where literally they're taking oral ascorbic acid until they get diarrhea, just to get, force as much vitamin C, in the body as you can. I don't think you can duplicate it, perfectly what the IV does, but at least it's a good option that we do. Right.
Yeah, it's a good option, but if you have the ability to do the IVC, it's much better. And who wants to have diarrhea and go through that the rest of the day after they've had a stressful dental appointment?
Yeah, exactly. Yeah.
But good point with the IV or the vitamin C.
All right. That Cheshire cat behind you on your left has a question. I can always tell.
Oh. No, I'm good. I'm agreeing. I'm just rocking the hairnet here.
Yeah, exactly. You can take that off of her now. We're torturing her. Take it off, Meredith. We're torturing her. Sitting back there grinning because she's looking at herself with it on, right? So.
I know. I'm just laughing. So. All right.
Somehow it suited you, Meredith.
All right.
It really suited you well. I'm just saying. I think we should wear that for more episodes, just in general.
Think about it. If I can take this with.
Yeah, I mean that is the procedure, and like I said before, just to reiterate, the perfect case scenario would be to start detox if you haven't, at least a week after this appointment at some point, just to get the ball rolling. And if you've had your fillings out, my gosh, find one of our doctors that we've coached around the country, to do this detox right, because again, most do not. And it's critical. I mean, you can do the best detox in the world, but if you have these sources in your mouth, then, my gosh, it's eventually, going to just make you sick. I mean, we got to get rid of the source, no doubt about it.
And vice versa. You really have to emphasize your part of it afterwards, because getting it out of your mouth is one thing.
Yeah.
It's already infected. It's already in your body. Most of it from the silver mercury fillings has been leached out.
Yeah, no, exactly. It's in your brain. Yeah, that's why we do a prep phase, which you do before, a body phase, which clears out the body, and you do a brain phase. And ultimately, people need multiple brain phases. It takes years, not months, to get this stuff out of the brain. And Derek, you know, one of our goals is always to teach the person the process, because it does take years, not months, you know. And, you know, it's to think what took 30 years to accumulate here, think you're going to get it out in 3 to 6 months, you know, really? I mean, you know, it does take a process, and that's why people need to be educated in that process. But look, I can tell you this, so many people are sick today and they don't know why. Hormonally, I mean, weight loss resistance, thyroid, I can go down the list. If, you know, there's a cause, there's a reason. And so many times it's right here in one of the subjects that we talked about today, you know? So, I mean, this is a very, very, very important topic. I mean, again, the only reason I even know about it is because of what it did to me, you know? So passionate on educating doctors about this. And I hope this video finds its way to more doctors and obviously more people who are going, why, you know, I do all these great things, why am I still not well? You know, look here for sure. And there is a right way to get it out of here. There's a right way to get it out of here. You know, and again, my goal is to spread it through as many doctors doing the right way as we can. So
You're doing a great thing.
Yeah. Hey, well, just on the last note, I mean, how do people find a safe dentist? Listen, I have clients that fly to you. I mean, I do. I have had many clients that come to you. You know, it's not like you have to be to you once a week or anything like that. I mean, maybe 2 or 3 appointments for most people, maybe some more, you know what I'm saying, but for some even 1. But point is, you know, if they can't make it to you, you're more than welcome to give them your information. Definitely do that. But what about if they can't? Where do they find a safe dentist?
Well, like I said, the two main resources would be the IABDM or the IAOMT. There's also a site called Mercury Free Dentist. I believe it's on.
Yeah.
I guess Dr. Mercola is doing
Yeah.
with them.
Joe's a friend of ours. He's very passionate. He's doing his thing right now this month for Charlie Brown.
Right.
It sounds funny every time you say that because people think I'm being funny, but no. Charlie Brown, you can tell him who Charlie Brown is, not the cartoon character.
Huge advocate for the banning of mercury in this country, and he's made tremendous strides in even getting it to be recognized and educating the public on it. So, like I said, this month is a big push in the mercury-free dentistry realm, and so you can go on those 2 sites that I mentioned before. There's Mercury-Free Dentistry. There's the DAM site, DAMS. That's another site that you could go on, and you can even call the Huggins Gruby Alliance. No, I believe if you Google them, I don't have their number offhand, but
yeah,
there's a couple sites you can find a good
recommended
dentist, and you have the questions that you could ask them. Go in with your questions and try to.
That's what I was just going to suggest. You know, seeing it now, you know, our viewers. If you're listening, if this is one show that you should watch, you know, get on the site and watch it. We have a lot of people who just download the podcast, but this one I think is worth watching because seeing it, you go, oh, okay, you know, that's what that looks like. You know, that's what that's the thing, the vapor and the oxygen. So, but yeah, I mean, ask those questions, folks. I mean, just because you go to one of those sites, a lot of dentists just get on those sites because it brings them business, and they may not be doing what they need to be doing. Right. So, you know, ask the right questions, find a dentist. And for me, hey, it's worth flying out to see you, you know, if I were one of my clients or someone watching, you know, but listen, we gave you a lot of good pointers, prep phase, the right removal, the right detox, you know, all of these things, critical, you know, to look for. So, Derek, thank you. I mean, I just, it's amazing the journey we've taken, right, from the beginning of when I sat in that dental chair. Wonder if that was the chair. Is that the room? Wonder if that was it.
That's a different one now, but I threw that one away. I don't want to have any memories of that.
That's funny.
I thank you, Dan, and God bless you. Whatever, all the things that you're doing, one of the leaders in the country, if not the world, and what you're doing, it's amazing. And I'm just blessed to be happy to be a part of it. So.
Now, listen, you spoke at my seminar, and the doctors just absolutely sucked you for the knowledge there, and really appreciate it. You know, we're on a mission, man, and you're with us, so thank you. So.
Yeah, and I'm always available if anyone wants to talk with me. I call people back all the time, or talk to patients all the time, and people that just want information, and I'm more than happy to help. So.
Oh my gosh, Derek, huge heart.
Not you.
Yeah, gosh.
Well, I don't want to make this a plug or anything. I think I'm on your site, your TCD site, Dan, or there's a video of me on there or something of that nature. And I don't know if you want me to give my number out or my.
Yeah, fire away, man. Fire away.
Yeah, my website is it's just Dentistry.com is my website.
Spell your name, because there's a zillion ways to spell Grieco. Well, at least two.
Yeah, it's Grieco Dentistry.com, and you can get on my website. There's some things being reconstructed on it, but it's functional. And also my office number is 724-327-4130.
It's awesome.
So, more than happy to help anybody and help anybody that I can.
Nah, that's your heart, man. There's no doubt about it. Well, we couldn't have given our viewers and listeners more information than that, Meredith. So, thanks for going there, Meredith. That was awesome seeing it. And would you check her cavitation, please? Check her for.
Yeah, we are. She already sent me her Panorex, and we're going to check her out.
We're going to check it out. And thank you so much, Dr. Grieco. Thank you, Dr. Pompa, as always. And we've talked a lot about these phases, too. If you're listening and you want a little bit more information on the phases, go to revelationhealth.com. That's Dr. Pompa's supplement website. And you can get the prep, body, and brain phases separately to undergo true cellular detox after you get that safe amalgam removal.
And I'll say this again, though. If you have health challenges, please find one of our doctors. Those are very simplified. Please find one of our doctors who understand this. That's why we're doing what we're doing. That's why we're coaching them. You have to get it done right on the beginning and on the end. So, absolutely. And you can call, they can just call our website number, and, we try to assist everybody that calls in. So, all right.
Yeah, I'm going through it myself, the TCD program with some doctors here locally, and they're top-notch professional. It's just been amazing so far. So
yeah. And if we can hook you up with a practitioner when you call, we'll speak to you, and we will. So that's where our heart is. So okay, thanks guys, appreciate it.
All right,
thanks
everyone for watching. Have a great weekend, and we'll see you next time.
Okay, see ya.